Every single day, in operating rooms across the country, surgeons are fighting battles that should never have needed to happen. Patients arrive not because of sudden bad luck, but because something silent has been building inside their arteries for years. A tiny plaque, almost invisible, slowly grows without pain, without warning. Until one day it ruptures, and in a matter of seconds, everything changes. A heart attack, a stroke. And here is the truth most people never hear clearly: cardiovascular disease is the #1 cause of death in every developed nation on Earth. Not cancer, not accidents. Your blood vessels are the real threat and the most dangerous part. Most people have absolutely no idea what is happening inside their arteries right now. You may feel fine. You may think you are healthy, but inside, damage could already be progressing. The system is not designed to catch this early. It reacts when something goes wrong, not before. That is why you need to understand the warning signs yourself. Today, I am going to give you the 3 symptoms that mean you do not wait, you do not delay. You act immediately. The first one happens during effort. You are climbing stairs, carrying groceries, or doing something physically demanding, and suddenly you feel a tight, burning, or squeezing sensation in your chest. You stop, you rest, and within minutes it fades. Most people dismiss this. They call it fatigue or stress. It is not. This is exertional angina. It means your heart is not getting enough blood during effort because your arteries are narrowed. That pain is your heart asking for help. Ignore it, and the next time it may not go away. If you experience this, you need a cardiologist immediately. This is not a suggestion. This is urgency. The second warning sign is even more dangerous because it is easier to ignore. This involves your brain. You may notice moments where your thinking feels slower, your focus is weaker, or something just feels off. But the real danger comes in sudden episodes. One arm feels weak, your face droops slightly, your speech becomes unclear. For a few moments, and then just as quickly, everything returns to normal. Most people shrug this off because it disappears, but this is not harmless. This is what doctors call a transient ischemic attack, or TIA. It is a temporary loss of blood flow to the brain, and it is often the final warning before a full stroke. Think of it as your body firing a warning shot. The next time, it may not be temporary. The third sign appears in your legs. You walk a certain distance, maybe 200 or 300 meters, and suddenly your calves begin to burn and cramp intensely. You stop, you rest, and the pain disappears. You start walking again, and it returns. Many people assume they are just out of shape. They are not. This is called intermittent claudication, and it means your leg arteries are narrowed, restricting blood flow. This is not just discomfort. This is a serious vascular issue, and here is a statistic that should shake you. In severe cases where circulation fails completely and leads to amputation, the 5-year survival rate is only 10%. That means 9 out of 10 people do not survive beyond 5 years, not because of surgery, but because their overall health collapses afterward. These 3 symptoms are not minor issues. They are signals that something critical is already happening inside your body. Now let's go deeper, because understanding what is actually happening inside your arteries changes everything. Atherosclerosis is not rare. It is universal. If you live long enough, it will develop. Doctors who perform autopsies confirm this again and again. In younger individuals, the inside of arteries is smooth and clean. But in people over 60, those same arteries are lined with deposits. These are plaques built slowly over years, and when these plaques harden, calcium builds up inside them. This process can go on silently for decades. The danger is not just the presence of plaque, but its stability. A stable plaque may sit quietly without causing immediate harm, but when inflammation weakens it, the surface can rupture, and that is when the real danger begins. The body reacts to this rupture as if it is an injury, sending clotting agents to seal it. A clot forms, and if it blocks blood flow completely, the result is catastrophic. A blocked artery in the heart causes a heart attack. In the brain, it causes a stroke. This is how quickly things can change. One moment everything is normal. The next, life is at risk. But here is something important to understand. Finding plaque early is not a death sentence. It is an opportunity. It gives you time to act before things reach a critical stage. The key is not panic, but awareness and action. When we look at the real causes behind severe atherosclerosis, the pattern becomes clear. Nearly 80% of serious cases come from just 2 factors, smoking and diabetes. Smoking damages the inner lining of your blood vessels every single day. The toxins create constant injury, and your body responds by trying to repair that damage. This is where one of the biggest myths in health falls apart. Cholesterol is not the enemy people think it is. Cholesterol is actually part of the repair process. It is sent to damaged areas to patch them up. The real problem is the damage itself. If you stop the damage, the buildup slows. Diabetes creates a different but equally dangerous problem. High blood sugar changes the structure of your blood and vessel walls. Everything becomes thicker, slower, and more rigid. This environment is perfect for plaque formation. Over time, this affects both small and large blood vessels, leading to serious complications. Hormones also play a role. Women are protected to some extent before menopause due to estrogen, which helps maintain vessel health. After menopause, that protection fades and risk increases. Men experience a gradual hormonal decline as well, which contributes to similar risks. Combined with lifestyle factors, this explains why cardiovascular events become more common with age. As plaque builds over time, the artery slowly narrows, reducing the flow of blood. Early plaques are often stable, covered by a protective layer, but when inflammation enters the picture, everything changes. The plaque becomes unstable, weak, and prone to rupture. Imagine a balloon stretched too thin. When it bursts, the body reacts instantly, forming a clot. This clot can partially block the artery or completely shut it down. That moment is what triggers a heart attack or stroke. These events are not random. They are the result of processes that have been developing for years, and yet most people only think about them after something happens. That is the problem. Prevention needs to happen earlier. The good news is that there are ways to detect these issues before they become life-threatening. One of the most effective methods is imaging your arteries, especially in areas where plaque tends to form first. Catching these changes early allows you to take action before symptoms appear, and that is where real control begins, not when damage is already done, but when you still have the chance to change the outcome. Now that you understand how atherosclerosis develops and why plaque becomes dangerous, the next step is knowing how to detect it before it turns into a life-threatening event. This is where most people fail, not because they don't care, but because they simply don't know what to check. The most effective and accessible test is a carotid artery ultrasound. This scan focuses on the arteries in your neck, where blood flow naturally becomes turbulent due to branching. That turbulence creates stress on the vessel walls, making it one of the earliest places where plaque begins to form. A simple, non-invasive scan can show the thickness of your artery walls and detect plaque long before symptoms appear. This is what real prevention looks like, catching the problem before it becomes visible through pain or disability. But imaging alone is not enough. You also need a detailed blood analysis. Not just total cholesterol, but a full lipid profile that breaks down HDL, LDL, VLDL, and one critical marker most people have never even heard of, lipoprotein A. This marker has emerged as one of the strongest predictors of cardiovascular risk. If it is elevated, your risk is significantly higher regardless of other factors. The mistake many people make is relying on basic tests that don't tell the full story. By the time symptoms appear, damage is already advanced. Early detection is your advantage. It gives you time to act, to slow progression, and in some cases, even stabilize the condition before it turns into something far more serious. Once atherosclerosis is identified, the next question becomes treatment, and this is where confusion and fear often take over. Many people are hesitant about medications, especially statins, because of what they hear online. But here is the reality. Atherosclerosis is one of the most studied conditions in modern medicine, and the data is clear. Medications are not just about lowering cholesterol, they are about stabilizing plaque. When plaque becomes inflamed, it becomes unstable and prone to rupture. That rupture is what triggers heart attacks and strokes. Statins work by reducing inflammation inside the plaque, making it more stable and less likely to rupture. That alone can be life-saving. Another medication option works differently by reducing how much cholesterol your body absorbs from food. When used together in lower doses, these treatments can achieve powerful results with fewer side effects. The key is balance. High doses may cause discomfort for some people, such as muscle soreness or mild liver enzyme changes, but these effects are often manageable and can be adjusted under medical supervision. The biggest mistake is refusing treatment entirely out of fear, because without treatment, the risk does not stay the same. It increases over time. The goal is not just to lower numbers on a lab report, but to reduce the risk of a sudden catastrophic event. That is what these treatments are designed to do. But medication alone is not enough if the underlying causes remain unchanged. There are 5 major factors that accelerate plaque growth, and ignoring them will undo any progress you make. The first is smoking. This is not a minor contributor. It is one of the most destructive forces for your blood vessels. Every cigarette introduces toxins that damage the inner lining of your arteries, forcing your body into a constant cycle of injury and repair. The second factor is high blood sugar. In diabetes or even prediabetes, excess glucose changes the structure of your blood and vessel walls, making them stiff and vulnerable. The third and often most underestimated factor is high blood pressure. Unlike pain or discomfort, hypertension often has no symptoms, but inside your body, it is constantly stressing your arteries, making them thicker, less flexible, and more prone to plaque buildup. The fourth factor is excess body weight. Fat is not just stored energy. It acts like an organ, releasing inflammatory signals that affect your entire system. And finally, chronic infections or inflammation in the body, even something as common as untreated dental issues, can contribute to plaque instability. These factors work together, not separately, and unless they are addressed, the progression of atherosclerosis continues quietly in the background. Now let's talk about what you can do starting today without relying entirely on medication. Movement is the foundation. Your circulatory system depends on motion. Walking at a brisk pace for around 10,000 steps a day has been shown to significantly reduce cardiovascular risk, but if time is limited, short bursts of intense activity can be even more effective. High-intensity interval training, even in short sessions, forces your heart and vessels to adapt, improving circulation and overall efficiency. Temperature exposure is another powerful tool. Cold showers or brief cold water exposure cause your blood vessels to constrict and then expand, improving their flexibility and responsiveness. Nutrition also plays a critical role. Reducing refined carbohydrates and sugar helps stabilize blood glucose levels and reduces stress on your vascular system. Many people believe the body depends heavily on sugar, but in reality, it can produce what it needs from other sources. The challenge is breaking the cycle of dependency. At first, reducing sugar may cause cravings or discomfort, but these symptoms are temporary. Over time, your body adapts and your metabolism becomes more stable. Small daily actions like these, when repeated consistently, create a powerful protective effect on your cardiovascular system. Finally, we need to address something that is often ignored but has a profound impact on your vascular health: chronic stress. This is not just an emotional issue. Stress directly affects your body through hormones that increase blood pressure, disrupt sleep, and promote inflammation. When stress becomes constant, it creates a long-term burden that slowly damages your arteries. This is why people with high stress levels often experience worse health outcomes, even if other factors appear controlled. The solution is not simply to avoid stress, which is impossible, but to manage it in a way that prevents it from becoming chronic. Alongside this, timing is everything. Most serious cardiovascular events occur around the age of 50, not because they start at 50, but because damage has been accumulating for decades. That is why the most important time to act is before that point, ideally starting in your 40s. Regular checkups, consistent monitoring, and early intervention can make the difference between prevention and emergency treatment. The reality is simple. You cannot rely on symptoms to tell you when something is wrong. By the time symptoms appear, the process is already advanced. But if you take action early, understand the risks, and follow a structured plan, you can change the outcome. This is not about fear, it is about awareness and control, because when you understand what is happening inside your body, you are no longer reacting, you are preventing.